Hello, so it is the surgery vlog. I'm getting MALS surgery, and if you don't know what MALS is, it's basically where your celiac artery is compressed by nerves, scar tissue, or the median arcuate ligament. So I am getting my nerves addressed. I'm getting all damaged nerves removed in this surgery, and I'm also getting, of course, the ligament completely taken out that is compressing my celiac artery. I've been diagnosed with MALS for 3 months now, but I have had symptoms of MALS probably for my entire life, but it got a little bad in the 6th grade, and then it got a little bad in the 12th grade, and it just got worse and it grew progressively. And I'm 17, so I've basically had symptoms since I was 11. This surgery is counted as a major open surgery. Its recovery is very hard, and it's only about an hour, hour and a half long surgery, but recovery is the hardest part. I'm gonna have about a 5-inch long incision from 1 inch below my breastbone all the way down to an inch or 2 inches above my belly button. Which, if you have seen my previous videos, you already know that I have a scar across my stomach from when I had a nephrectomy, which is my right kidney removal because I had Wilms tumor when I was younger. So I'm basically gonna have a cross scar across my stomach, which is pretty sick. I'm kind of excited about that. It's about to be March 7th and my surgery is March 9th. So I have 2 more days till surgery. And all because of the presence of God and the glory of God. Ugh, I have been in such peace. I've always naturally been a very anxious person. Always anxious about everything, needing to know every detail about every situation so that way I can know what to expect and I can prepare myself. But being so steadfast in reading his word and just praying and surrendering and just sitting in his presence has helped. Oh my gosh, it has helped so much. I got my church praying for me, I have my friends praying for me, I have a bunch of people praying for me, and I'm so hopeful that this is going to be a successful surgery. Many people do have MALS symptoms from actually other issues, which is why with MALS, it's very important if you are diagnosed with MALS that you actually rule out every other possible condition that could be causing your GI symptoms. And a fun fact, 30% of the world population actually has MALS anatomy, but only 1% of that 30% actually has symptoms. I would like to say, whether this surgery is successful or not, that I'm getting the surgery to get relief from nausea and epigastric tenderness. I can't wear a bra. I can't wear anything that's going across my waist. Like, literally one day I wore a very loose skirt around my waist, and within 5 minutes I was like running to the toilet because I was almost throwing up because my stomach is just that tender, and it just gets really bad sometimes. So my epigastric area is tender all over, all the time. Sometimes it can just be mild, sometimes it can be very extreme. It gets a lot worse after eating, but I rarely ever get pain with MALS. We have crossed out every other possible condition. I've been diagnosed with MALS, and I have POTS, EDS, and mast cell activation syndrome. So it's not surprising at all that I do have MALS and I am having these symptoms because it correlates with MALS. Also, I was trying to say that MALS also usually goes along with having EDS, POTS, dysautonomia, and MCAS. Usually they all come together, so when you have POTS, there's also a 50% chance that you may have also MALS. So the point I was trying to get across is, if you have POTS, MCAS, and EDS, or if you only just have POTS in general, and you're having GI issues, stomach issues, you're having abdominal pain or nausea or epigastric tenderness, and just a bunch of GI issues, and you can't find anything, you most likely have MALS, and that's what's giving you the issues. Go and get checked out. You need to have a Doppler, ultrasound, and you also need to have a CTA with contrast. An angiogram is usually the best way to get diagnosed, but obviously that's more of a invasive approach because, you know, they have to put up a wire in you and everything like that. So a CT angiogram with contrast and also a Doppler ultrasound will show if you have MALS. It's also very vital that you get checked out by a very well-known MALS surgeon. So I really recommend that you go on the support group on Facebook for MALS Pals. That's the support group I'm on, and they will tell you all about what doctor you should go to in your area that is very experienced in MALS. Also, so many people suffer from having other vascular compression syndromes like Nutcracker syndrome or SMAS syndrome. Always get checked out before you have any surgery to make sure that you don't have any other compression syndrome, because a lot of people have it in pairs where they will have MALS and probably like in CS or something like that. So get checked out to make sure you don't have any other vascular compression syndromes, or you may have to get a second surgery after your other surgery when you could just get it 2-in-1. So really do look into that, because many people get the surgery and suffer after the surgery because they didn't get checked out beforehand. So yeah, we were 2 days out from surgery, and I reached out to my support group on Facebook. That is how I really found out the depths of information about MALS and how to get diagnosed and everything. So I am so grateful for them, because they have helped me so much. I'm sorry if this video is going to be a little bit of everywhere. It's very hard to coordinate how things should be in an order and everything, because everything is out of whack right now. I'm getting surgery, so I'm sorry if this video isn't perfect. He is at University of Maryland in Baltimore. I live in Maryland, so it's not too far of a drive. It's still a long drive, but it's obviously not as bad as if I was out of state. So yeah, my surgery is on March 9th. It is on a Wednesday. I have to be there at 5:30 to check into the inpatient clinic, and my surgery starts at 7:30. I'm getting an epidural for pain management. Now, my support group has asked a couple questions. So one person asked if I could state all of my symptoms before surgery. So like I said, my top symptoms are epigastric tenderness and nausea. I also have globus sensation. So really, whenever my epigastric tenderness gets bad or it gets stronger, my nausea gets triggered right away, and I get really nauseous. And then I start to have almost like, I'm so nauseated, and this area is so tender that it starts to cause like me to feel like my gag reflex is triggered. And it starts to make me feel like I'm almost gonna throw up, because it's not that I feel that sick. I mean, I do feel sick, but it's not to the point where I feel like I'm actually about to throw up. It can be sometimes, but not all the time. So for the most part, it's just my epigastric tenderness is so bad that it almost like just creates like this globus sensation, where it's basically so sensitive, like I just hardly go over it, and it just kind of, it makes me feel like I want to throw up if I press hard on it, which everyone's is like that if you press hard on yours, but I can feel mine when talking. I can feel mine all the time whenever my epigastric tenderness is triggered. Whenever it's very low or it's not that triggered, then I don't feel it. But whenever it is, so if I eat, if I drink, if I work out, which I can't work out anymore because I would get too nauseous. I can't enjoy going out to eat. I can't enjoy roller coasters or anything like that, because too much movement can cause me to feel nauseous. I get nauseous very easily. I have flare-ups of sometimes where my nausea will be so bad I don't want to eat a single thing, and sometimes my appetite can be good and I will eat pretty good pretty frequently. The surgery does have a chance. I don't know the percentage, but it does have a percentage of helping reduce my POTS symptoms. I've heard a lot of people say that it has helped them tremendously. I've also heard other people say it hasn't helped them, and I've heard like 1 or 2 people say it made their POTS worse. So the surgery could also help me with that, so that's also another plus. Also, anyone with MALS, I've never heard them get better. They've always gotten progressively worse from what I've seen, from what I have heard from on my support group. They always progressively get worse over the years. A lot of people, when they finally go to get surgery, their artery is so just screwed up that they have to do stents, and it's just a lot harder. So the surgery is also preventing me from having to do it in the future. The symptoms I have now impacts my quality of life so much that the surgery is just worth it, because it can give me my life back. I'm 17, I have another 60, 70, 80 years of this life, and I want to be able to enjoy it. And if a surgery, which has a recovery span of a year and a half, if I have even a complete miserable year and a half, but it gives me a very good quality of life, a normal person's quality of life for the rest of my 60, 70 years, then that seems very worth it to me. Also, I've gotten a very bad anxiety problem. I have emetophobia, so I'm constantly afraid of throwing up. It has gotten better as I've became aware that my anxiety is because of my sickness. I always thought my anxiety brought on my sickness, so when I was diagnosed with MALS, it really cleared up a lot of things for me, a lot of confusion. And also, this sickness in general, it just really cuts down on my mental health. I'm a very joyous, happy person. I always have been, especially with my relationship with Jesus Christ. I mean, I have so much joy, but because of my POTS and because of me feeling nauseous and just not feeling well and feeling sick, it is very, very hard for me to be able to show my joy to anyone. I mean, I can have a happy face, I can be social, but I really find myself not showing people the actual joy I have from God, and that's kind of a problem for me, because I want people to see the joy I have. I want people to see the happiness that God gives me. and I can't really show him that. Whatever he wants me to do, I'm gonna do. And I have complete trust and I have complete faith that whatever his plan is, even if this surgery does not give me my life back, that I've really never even gotten to experience, because from everything that I can remember, I've just always felt sick and I just thought it was normal. And I know the main thing that I will want out of this is to help other people who, you know, I could help so much people with these videos just to know what to expect. I mean, a simple seeing someone in the hospital room and seeing nurses coming in and seeing what's all around you, seeing how big the room is in case you're going to University of Maryland for this surgery. I mean, I like to know that stuff personally, so if anyone else does, then it can be there for them. So I'm gonna record literally as much details as I can. I'm gonna be sharing you my pain level. I'm gonna be sharing with you if there's been any symptoms that have been going away, whatever it is, you're gonna know. So yeah, the next thing that you will be seeing is me going and getting ready for surgery. So we finally got here and we're registering right now. I had to pee in a cup, and now that I see all the medical stuff, it's kind of freaking me out. So I'm a little nervous. We've been running around the hospital for 15 minutes trying to find this area. So I'm so thirsty and my stomach is so nauseous. I already was before and now it's just worse. So I'm not feeling good at all right now. But God is still giving me peace big time. So I'll let you know whatever we do next. Okay, so I'm about to get changed and start the ball rolling. They're about to put in my IV. This is just to numb my skin. And then things are rolling. They already did my vitals and everything, so it's happening.
Today's gonna be rough. Tomorrow's gonna be worse. But tomorrow you're gonna have to get in a chair. You're gonna have to get up and move around a little bit. You know. Every day we don't meet our milestones. It sets you back about 4 days to a week. Goal of the surgery is for you to be back home within 3 to 4 days after surgery. All right. The things that hold people up are nausea and the idea that they have to be tolerating food. You really don't have to be. You just have to be able to tolerate enough liquids to prevent yourself to get dehydrated. Over the next several months, you will be extremely nauseated and you will have bouts of vomiting, and it'll be pretty horrible. You'll complain that you wish you never went through the surgery and stuff like that. Happens to everybody. It's very normal. You'll lose weight. Also very normal. The nausea after this is very hard to control. So you'll have an incision kind of above the belly button, upper midline. We'll close it up with all absorbable stuff so nothing will have to come out. You'll have like surgical crazy glue on top, and that will peel off on its own over the course of a week or two. After about 2 days, you'll be okay to shower. Today, you'll be on a little pain pump. The goal is to get that off of you by probably tomorrow or the day after. Probably the day after tomorrow. Okay. And transition you to longer acting oral medication. It's important to keep yourself regular after surgery. The most common reason why people end up back in the emergency room is constipation and excessive nausea and vomiting related to constipation. So it'll be super important afterwards to be on a very aggressive bowel regimen.
What's the main reason for the nausea afterwards?
We're messing with the autonomic nervous system.
Just because of what you're taking out, all the stuff. Okay,
yeah. And you know, that area of the body, I mean, there's so much important stuff there. There's the pancreas, the stomach, the liver, and they all get kind of
shocked,
unhappy.
Yes, they're being shocked. I got you. Okay, just asking.
Yeah, but the nausea is pretty profound for most people afterward. We will have you sign some paperwork to get things moving. I'll come and talk to you after I'm sure everything's okay. The surgery takes about an hour or so.
Okay.
But getting her back, getting her to sleep, waking her up, all that stuff, it'll be about 3 hours before I come to see you.
Okay. Good to know.
You'll wake up without a Foley catheter in, you'll wake up without a tube in your nose, you'll have them temporarily while we're doing the surgery, and we'll take them out before you're done. Which means when you gotta pee, it means you gotta get up out of bed. We'll have to ask for help to get you to the bathroom, okay?
Just a little routine paperwork. So this is the surgery consent.
Okay.
And it's the same stuff that Dr. Nagelschitz already discussed. Very rarely do you need to go back for a reoperation in case there's some postoperative bleeding or any other complication.
Am I getting a pain management epidural thing?
Not for this surgery, no. I asked Dr. KJ about that. He said he didn't think you'd need it. It's a very short procedure today and a small incision, so we're just going to do general anesthesia. But I'm going to talk to all about that in just 1 second. You had a kidney taken out too?
Yes.
Okay.
A right nephrectomy.
Right nephrectomy. How's the one kidney working? Okay?
Yep, good. Okay.
Our plan for today, we're going to do general anesthesia. Just when the time comes, we'll get you on back to the OR. You're gonna breathe some oxygen. We'll put some monitors on for you. You're gonna breathe some oxygen. I'll give you some meds through the IV. We'll put you out to sleep. We'll put a breathing tube in to keep you asleep with our anesthesia gases. We'll give medicine for pain and for nausea. When they're done, we'll take that tube out, take you to recovery. We'll start a second IV, but that'll be after your sleep. And we'll get you going shortly. I'm just gonna try to put your IV in real quick, okay?
Yep. So just to give you a little heads up what's going to happen once we go into the OR room, I'm just going to have you say my name again. We'll move the stretcher with your arms up to our OR bed. I'm just going to have you like scoot over onto the bed. Okay. Once you're there, you're going to lay really still.
Okay, so I'm about to go back. They put in my IV. Everything's done. The consent forms are good. So now I'm about to go back right now. They're about to give me relaxing medication. And we're no longer doing the epidural. He says he really doesn't think that I'll need it. But he's really expressed that today is going to be horrible. So that made me really, really nervous. And yeah, I'm kind of ready, but let's do this.
Give you the good stuff, okay?
Oh yeah.
Might just sting a little bit going in, okay? Might make you feel a little giggly, okay?
Let's see it, Lacey.
Maybe a little teary sometimes, but
Really? Aww.
but then you won't even remember going
Right.
back, so it's good.
Oh. Sweet dreams, sweetie.
Now I know what it's like to be high.
Oh gosh.
Hey, that shows I've never done it before. Yeah.
Well, how do you know what it feels like?
Yeah.
That's what I'm saying. This is
Uh-huh.
what I'm assuming.
Okay, keep talking, spilling the truth. Bye. Love you.
About the block thing, because when people have multiple blocks, it just leads to so much more inflammation and scar tissue formation,
Oh.
and it makes it so much harder. It's actually
really?
much riskier to do the surgery. So
Wow.
yeah,
And she had two.
yeah, and so every time I've had people that have had multiple blocks, it's really kind of scarred like this.
That fast, huh?
Yeah,
Wow,
it
okay.
happens almost immediately.
Did her scar going across?
Yeah, it posed quite an issue because she had a lot of scar tissue from that too. So we had to take down a decent amount of scar tissue to her liver, just to move the liver out of the way.
Okay.
That was all
Wow.
kind of scarred to her incision.
Okay.
To mobilize that away.
Would you happen to know if that would cause any nausea, all that scar tissue?
You know, it's possible. I didn't explore the rest of her intestines,
Yeah.
but I have a feeling that they're probably all kind of
Okay.
fused together.
Would that be a problem in her future, you think?
I mean, it probably will result in the same thing that she's having now if that's what's causing the nausea, right? Because if her nausea is not coming from this, it's not going to get better.
Right.
Because I didn't do anything to anything else.
Yeah.
All I did was release the compression
Yeah.
for the median artery ligament. So
Okay.
whatever symptoms related to this should go away.
Yeah.
Because this is no longer a problem.
So it took long because she had so much.
She had a lot of scar tissue, and it was probably not just from the compression, it was probably from the repeated block. But yeah, it's more released now. It looks much better. She doesn't have a median artery ligament anymore,
Okay.
so that's
Great.
gone.
Great.
And she doesn't have that scar tissue around the vessels anymore. And we did a fairly extensive neurolysis of all the inflamed nerves that were in that area.
Okay.
Her ganglia are fine. They weren't the issue.
Okay.
That's left out. So yeah, whatever was related to this, it's gone. So we can't have
Good.
issues related to MALS anymore.
Yay.
So whatever's left over, you know, it might be adhesions from her prior laparotomy. It could be something like that.
Okay.
Because there was
Yep.
definitely adhesions to her liver, which I had to resect and remove. If the liver is adhesed to this incision, then I'm sure her intestines are too.
As we go, okay?
They said you did great.
I did do great.
I knew you would.
I'm just gonna put this back on your arm, babe.
Okay. How you feeling, sweetie?
Strong, groggy. Do you want me to turn the light down and let you rest a little bit more? Because you're all done and you might need some rest.
It's okay.
Okay. Do you feel better if you can wear off the medicine for a little bit, okay?
Okay.
All right. Are you comfortable?
Yeah,
Okay. Should I get you some pain medicine?
probably.
Okay. She said her pain was a 6 out of 10. So
Okay.
I want to make sure it doesn't get higher than that. So I'm going to see what you can have and I'll bring you some medicine in a couple minutes, okay? If it gets really bad or worse, you let me know right away.
Thank you.
You're welcome.
Hi, sweetie.
Hi, Dad. Hello.
Hello. We just talked to your surgeon.
What do you say?
He said there was a lot of scar tissue. A lot. You got it all.
Yay. that means I was struggling a lot.
Yeah.
But I'm having some like pain in my shoulder.
Oh, are you?
And it's hard to take a deep breath, which is why I want the pain medicine.
Oh.
And I feel like it's gonna get worse if I don't take some. Jesus Christ, baby.
Yeah.
I couldn't have done it without you.
Once again.
The anesthesia lady that was very nice and taking me back.
Yeah.
And then I remember getting into the OR. I looked over to them. I saw the tools. And it didn't freak me out. It was really cool, actually.
Yeah?
I was like, oh yeah. And I literally had a dream last night, like, wondering if they would let me scrub in. Because I would always love to know what it's like to scrub in. Ow. Although my pain level's going up.
That fast?
Yeah.
Aww. It's coming, it's coming.
I need some drugs. Just kidding, I don't do drugs.
We know.
I know y'all know. I don't want them thinking I'm a druggie. So they gave me midazolam to chill me out, and that chilled me out really fast. That was really good and very helpful. They took me to the OR, and they just let me breathe oxygen for a while. And then they gave me the anesthesia, and I got knocked out. The anesthesia doesn't smell like anything. You still think you're drinking. You still think you're breathing oxygen. So it's not like you become afraid to breathe because you're afraid of going to sleep. It's not like that.
Yeah.
Which I was kind of afraid it would be.
You were back there for an hour before it even started. We got a text saying at 9 o'clock they started your surgery.
We're going to give you your pain medicine, okay?
Yay.
Do you know that you're going to get a button where you get to push the button and give your own pain medicine? Did they talk about that ahead of time? So I'm waiting for that to come. But in the meantime, I'm going to give you your doses until you get your button.
Thank you.
And this is Dilaudid. I don't know if they talked about what her pain medicines would be, but this is a good strong IV pain medicine, and this is what usually you get in your button that you push to.
That's good.
Dilaudid.
Dilaudid. Most people get Dilaudid.
She's done her research.
Have you?
Am I wrong?
Oh my gosh.
No, you are correct.
Yay.
See if that helps you. You can have another dose if you need to, if that doesn't do the trick, okay? So we do little doses. You can have another rather than give you, like, wipe you out all at one time, okay?
So people, if you want to know what the pain is like, it's kind of just like in your epigastric area. You just feel like it's really sore, and you feel like you just got cramps. So almost like period cramps, but up on your epigastric area. Shut up.
Do you want to try to sleep?
Lol.
What's up, guys? So I'm out of surgery, as you can see from the video. I have 3 IVs in right now. And then I have one on this hand. And I have an allergy bracelet on because I'm kind of allergic to adhesives. I get rashes. So I've been given Dilaudid, and my pain level has been really good, and I'm very proud of myself. And it really hasn't been that hard so far, and I really think it's by the grace of God. I'm really doing so good. And praise Jesus. Whoop, whoop. Oh, it kind of looked like I gave the middle finger. I'm sorry. But yeah, I'm doing very well. My heart rate is kind of high, but it's because of all the medications. And they're about to find me a room now. And I think that's all the update, Mom.
Yeah, I think so.
Oh, I've also been given a little tad bit of water just to keep my mouth from getting too dry. So that's been helping a lot too. Basically, they didn't want me drinking a lot of water because of all the anesthesia that was still left in my system from waking up. So they didn't want me to throw it up all and, obviously hurt my incision. So they only let me have like very, very small sips of water. Dr. Nagerseth just came in and said I was very scarred. Okay, you're gonna need to pull me. I can't use my abdominal. What are you trying to do? I'm just trying to scoop my butt back.
Wow.
Yo, I'm doing so good. Oh.
It's 3:15 and I'm about to go to my room now. My nurse says that I've been extremely calm and my attitude and everything has been amazing. So she told my surgeon that I'm going to get through this just fine and that I'm really strong. And it was so sweet and it was so nice. So yeah, we're getting ready. They just set up my pain pump for Dilaudid. I think I get 0.2 mLs. And then I have my button I can push. But they're about to move me to my room. They said it's really bumpy. So I should click it soon to help me with the bumps. Because she said it's going to be really painful. And putting pressure on my incision will really help. We're moving things along. It's going really great, seriously. So this is amazing. So I finally got to my room. I'm going to have my mom show you what the room looks like and how it is. That's the bathroom. Ta-da! And that bed right there, that's my mom's bed. That's not someone who's coming in. I had to pee because of all of the fluids they gave me. So I got up and I went to pee. Then the doctor came in, not the surgeon, but the doctor under him. And he's a resident and he came in and he checked out my incision and everything. The worst my incision has been is a 7 out of 10, 10 being the worst. And the lowest my pain level has been is a 3. And it's seriously, it's tolerable, not miserable at all. So it's going really well so far. And they think that I may even be able to go home tomorrow. Because they said maybe I just need to be here at least just one night because I'm just doing so good. So God is really coming through for me. I literally am like almost in disbelief. First time eating something all day. But I'm afraid it's gonna upset my stomach. It's delicious. I slightly mentioned something earlier that I did not get the epidural, but I just really want to point out how much God has came through for me, that I'm not even on the epidural, which I've seen most people do with Dr. N's surgeries, and I'm not even on that, and I'm doing amazing. I'm just mind blown how good I'm doing. So my surgeon just came in and checked with me and see how I was doing. I asked about wearing an abdominal binder, so I'm about to do that. Also, I'm starting to get a little rash up here, and rashes along my incision line where I have my bandage, and so I'm kind of having a muscle activation reaction to it. So they started me on Benadryl. Also, this IV that was in my hand was starting to hurt, and they really weren't using it. So we just got that taken out. I still have this IV and this IV. Whenever I get the chance to show you my incision, I will show you. But they said we're going to leave on the bandage for about a day or two. So I will show you it. Just be aware that I will be showing you that because I don't want you to get nauseous or anything from it. From the Jell-O, I did get a little nauseous afterwards for about 5 minutes. And then I went away, so it was really good. I'm also, like, really tired because I haven't really slept at all after surgery. I've kind of just, like, laid here and closed my eyes. And I try not to go to sleep because naps don't agree with me because of my mast cell activation syndrome. So whenever I go to sleep and I'm not, like, asleep for a long time, then I will wake up feeling so sick and miserable, like, literally on the verge of vomiting. And it's really bad, so. Also, I asked my surgeon about the scar tissue that was on my liver that they had to remove. I was curious if that could have been causing me my epigastric tenderness and my nausea from before surgery. So I was asking if maybe that was the reason I was having symptoms. And he says there's really no way to know, but the inflammation was a lot worse than he expected, and he thinks that could be because of the celiac blocks that I had. It created more scar tissue and inflammation, and he said he took a picture of when he cleared everything out, and he'll show me it. Also, keep in mind that nurses come in and change shifts every day at 7 or 7:30, and every single time that they switch shifts,
They will come to you and introduce the new person taking you on for the rest of the 12 hours. Are you ready? I'm gonna need help.
Don't forget the doctor saw you naked.
Way to make me feel better, Mom. When I say, you ready? 3, 2, 1. Okay. We're gonna have to.
Hey.
Oh boy. I need you to pull this.
We're getting ready to pull.
Yeah, keep pulling where you need to get. Oh!
Let me call you back. A gap here, so I'm trying to pull this up.
So, in case you didn't see what happened, basically, my gown was underneath my butt, and I couldn't put my abdominal binder around me if I couldn't lift up my gown. So, I had my mom pull the right side of my gown up from underneath my butt. And because, like, I couldn't push myself up anymore, I told her to pull it. And so, she did. But after she already got it out from under my butt, for some reason, she kept pulling. And when she pulled, she yanked it, like, as hard as possible. And so, when it was out from under my butt, the gown went super tight and pulled all across my incision. It hurt so bad. As you can see, I'm literally crying. It was really, really bad. As you can tell, we argued. So my biggest tip is before you go into doing the surgery, if you have a mom, if you're a pediatric patient, or any case, if you have a significant other, any member that is going to be with you that could be helping you, have a conversation with them beforehand and let them know, like, before you do anything, ask me, set up like a 3, 2, 1. What happened several times was my mom wasn't thinking and she just did what I was insisting instead of letting me count 3, 2, 1. And so she would like start pulling me up to lift me up before I even said I was ready. And so that would just start to cause me pain. And what would be happening was I would get super stressed out and super mad and emotional, and I would cry because it's already a very emotional thing. I'm in the hospital, and then when you just get frustrated because you keep getting hurt because someone's, not counting and waiting till you're ready, it gets very, very frustrating and sends you into a spiral. So set it up beforehand. Tell your person to be very, very patient. Even if you get mad at them and you yell at them, tell them as hard as possible just to keep calm. Let the patient that had surgery just go off on you if you want, because I was so mad at my mom and I was like almost popping off on her, and she kept just arguing with me back, and it just turned into a huge argument. And what happened was I really built myself up. I made myself really, really hot. I made myself feel sick. I was in really, really bad pain for a long time after that, and you'll see that in this vlog. It also made me super, super emotional. Please discuss with that person, whoever's gonna be there, because it can save you what happened to me.
Brandy, I'll be the nurse tonight.
Okay.
Okay. 88 mLs? Yeah, so when you... Okay, given volume? 4.
Also, earlier when I coughed unknowingly. I didn't know it was going to happen. I had mucus come up, and it was a really hard, major cough, and I didn't have anything on my incision at the time because I didn't know that was going to happen. If you can tell, I've had more drainage and stuff because of it. So update, they took off my pulse oximeter earlier when I peed because really they didn't need it anymore. Now they want it back on just to make sure I'm good throughout the night. My surgeon came in, like I said, and he basically said the entire goal tomorrow is to walk, and walk, which I've already walked a little bit because I had to pee, and it went really well. So plan to walk tomorrow is a huge deal, and that's what we're going to do. Also, I've missed a ton of my medications for today. I was supposed to take in the afternoon and tonight. We've asked for updates, but they don't really know if we're going to be able to get them from the pharmacy. So even though we brought them here, they said they don't allow us to take it from home because of whatever. So they don't... I'm so tired, as you can tell. When I woke up from the anesthesia, I never went back to sleep again. So it's really kicking me in my butt. Like I'm literally going like, so nurses kind of just come in and out, asking how my pain is. My mom pulled the gown and it hurt a lot, so I've been really using the pain pump, and I've been leaking more fluid from my incision since then, and so they kind of checked it out and said it's not too much fluid, so it's fine. But I still haven't gotten to see my incision, and I think I get to see it tomorrow, because they'll probably want the air to get to it to help it heal. So the nurse is going to be coming in every 2 hours to check on my fluids and make sure I'm all good at 12 a.m. and 4 a.m. So every 4 hours while I'm in the hospital, they recheck my vitals. If I don't get up and walk around, that pushes me back 4 days every time I don't walk every day. So I have to make sure I'm walking a good amount. So I may walk a little bit before bed, just to kind of also get my gas pains moving, because I think I'm starting to have a little bit of gas pain. I forgot to mention that last night I only got like 2 hours of sleep at the max. I just kept tossing and turning and couldn't go to bed. I think because my mind was just constantly moving. So expect the night before surgery to not get any sleep. So make sure you get really good sleep for the time before. Also, I haven't pooped yet. We don't know how constipated I am. I also called in the nurse and had me switch my gown around, because every time that I have to access to my stomach, I have to pull it off under my butt and lift it up, and we know how that was last time. So the abdominal binder is a help, but I'm still having a blanket pushed over it because it still is just like really tender and everything. But the biggest thing that I've noticed is I have had this abdominal binder on for at least an hour now, and I'm not feeling like vomiting, which is a huge deal, because at any time where I had something tight like this around my epigastric area, I would feel like vomiting, and it would be really bad. So that's seriously a big progress. I have POTS. That's not acting up for me right now at all. I mean, I'm just a little out of it, but it's not like lightheaded or anything. So, which is really impressive, because we can take these off now, I just realized. Dr. N told me that my POTS would flare up like crazy after surgery. So far, it's doing really well. So I'm literally just gonna walk back and forth, because that's still plugged into the wall. The nurse took off my pulse oximeter, so I could not have to be attached to that. So I'm literally just gonna walk back and forth. I can't sit up fully. It feels like it's tearing my incision, so that's the bad part. And he said the more like I stretch it and sit up straight, the less it will scar. So I have been asleep for about 2 hours now. I thought it was already 7:30 in the morning, because it feels like forever, because you can't sleep because of the noises. It's bright in here. But I woke up and my pain is pretty bad, because I haven't been pressing my button to keep it under control. It's at like a 6 or 7. I just did my pain pump twice, and in another 10 minutes, my nurse is gonna come in and figure out what we do next to get my pain under control. So that's where I'm at right now. So my nurse just came in and did something to the pump, so I don't know what she did. But I just got another dose. I've gotten like 4 doses, like repeatedly, because it hurts. It just really hurts when like I breathe, and I have to breathe, so I'm kind of like stuck. I fell back asleep for about 2 hours, so I missed 12 doses, and this happened. I've pressed the pain button 3 times in the past 30 minutes, and I'm still in pain. So I'm either gonna wait a couple more minutes till my nurse comes in, because it's almost about that time, or I'm gonna call her in. My pain level is back up again.
Did you already push that?
Yeah, I've pressed it 3 times.
And it didn't do anything? What is your pain right now?
Like a 6.5. So they just gave me more water with ice in it, so it's nice and cold. Then
My pain has been going down because they've been giving me more drugs of Dilaudid. And then this one started leaking saline, but not from the catheter, so it wasn't because it wasn't in my vein anymore. It was just because it was coming out because of that blue thing. So she took off the tape and redressed it. I'm just chilling. I'm gonna set alarms to keep doing my pain pump. I mean, it's gonna be hard to do that every 10 minutes. That's not gonna be a good sleep, but it's okay. It is what it is. Okay, so right now we're drawing blood, but my veins are being stubborn. Okay, so I just got my blood drawn, and the nurse did amazing. It was having a really hard time going through, but she did some extra strategies, and it worked. So, if you can tell, my legs are really red and itchy. I'm starting to have a mast cell activation reaction. If you can get closer, I can show you better in the daytime. And I don't know if this is a good view, but my eyes are starting to get red around them. I started having a bunch of MCAS symptoms, so like breaking out, hives, rashes, and I had excessive itching, so they put me on Benadryl. But as you can see right now, this is where I was breaking out on my legs. So my mom's just removing the betadine that they used earlier to clean me of any germs for the surgery. So we're just taking that off now in case that was helping give me a reaction. So the doctor just came in, the resident. He came in, he checked out my bandage. I let him know how I was doing with the mast cell activation syndrome. My legs are itchy and everything. And he asked if I'd want to start on solid food. And I got a little nauseous with the Jell-O, so he says we can just take it slow and I'll just continue with just doing Jell-Os today. I'm going to talk to pain management because it seems like the Dilaudid like helps and stops helping, so they're going to figure out like another plan if they can. I'm sorry I can't like actually record when he's in the room. They don't allow it unless I ask for his consent. They usually come in at 7:30 a.m., but he came in at 5:30. So I wasn't really awake beforehand to ask if I could record, because I was just really out of it. Yeah, my pain right now is not that bad. Probably like a 5 is tolerable. And I was actually just getting some sleep just now, so going good ever since I got the bolus, which is the extra doses of Dilaudid. The one thing that I would say is the pediatric floor is very noisy. It sucks. It's not that bad, but definitely wakes you up quite often throughout the night and wakes you up early. There's just this one kid that's just always crying. I mean, bless his soul, of course, like I'm not upset. I'm just mentioning this.